Okay, I want to thank all three of you for those excellent presentations. We will now move into some Q&A. And the first thing, I'm actually going to take the prerogative and ask, talking about the increased incidence of both suicide and domestic violence that we're not surprisingly seeing and suspecting there's even more, do you have any advice for those of us in the field for reaching out and identifying and helping those people who are isolated, who are at most risk for these problems?
I guess I can answer that. I think that the most important thing is for a staff to arm yourself with resources and also just come right out and assess. I think in the mental health field, many of us are hesitant to assess people for suicide. Believe it or not, we still have that myth that if you ask, it's going to happen. Even among mental health professionals. So when I train student and clinician, I tell them, you just have to do it. You just have to do it. But don't just do it and then leave people hanging. You have to really have a lot of resources in your hands so you can make appropriate linkages, right? And linkages here doesn't mean, here's a number to call. You really need to do what the new phase that I've been talking about now is warm connects. You need to warm connect people. Don't just give them a list of phone number just to call on their own. So,
thank you, Dr. Chow. Dr. Park or Dr. Ramos, do you have anything to add to that?
I can add just to piggyback on what Dr. Chow had said. I think if you're speaking from a clinician standpoint, I guess, in terms of looking at your panel, looking at the folks that you work with and trying to figure out how do I reach out given all of these increased risks that are happening in the pandemic. I think, as Dr. Chow mentioned, asking about suicide. So, when we do suicide screening, there are various different risk factors that we keep in mind, and there are various different elements of a history that we try to assess for each individual. And I think in terms of my presentation, there are many things that I learned about in terms of caregiver risk for mental health as well as physical health that I think should be kept in mind as a risk factor, not just for depression, anxiety, for suicide, and knowing, as Dr. Chow said, that the financial impacts have been shown over time to have a significant impact on suicide. I wasn't aware of that, Dr. Chow, in terms of that there's a clear sort of correlation in terms of percentage unemployment with increased suicide risk. I think that those are the elements of what I think we can use as clinicians or folks who are working with people at risk for mental health illness during this time to gauge sort of our intervention and to have a more full kind of suicide and mental health screening approach. I hope that makes sense.
Thank you. Dr. Ramos, did you have anything to add?
Yeah, I would just say in terms of helping, I would screen everybody. And I would say also, we have the simple tools. The surveys to do so, and one thing to take into consideration is, as Allison shared, this is a covered benefit, and also the Women's Preventive Service Initiative just added anxiety as a recommended covered benefit as well for all women, and so we need to take the opportunity and just screen and help those that need it.
Okay, great. Thank you very much. So I'm going to jump. We've had several of the questions that we're getting. I'm going to direct to Dr. Chow because they have to do with the county directive around masks.
Okay.
And the question's asked in several different ways, but basically it's saying, for those people who wear masks, being around people who don't wear masks is causing stress. Can you give us some more direction and explanation of the county decision
Sure,
on not mandating masks.
Sure. So for those of you who live and work in Orange County this last 3 weeks, you probably have been following the major issue around masks. And it's not just in Orange County, it's all over in the country, and particularly in California. And I believe that the issue around mask covering and order and the role of the health officer has caused an exodus of a number of people who hold this position locally, particularly the health officer. You probably heard people who resign, people who retire early, and people who basically was fired because of this public health order that had been turned into politics. And so in Orange County specifically, when we applied for the variations to reopen the community, our former health officer and I decided that we will put in a requirement for masks for everyone to wear in Orange County. Unfortunately, our local sheriff also publicly said that he won't enforce it. So you see the dynamic between having an order but no way to enforce it, right? So it caused a lot of anger from a group of folks who thought or still believe that this order is impinged upon their individual right. And I have publicly said the science of mask is new, and we know this. Every day, every week, there's new publication talk about masks from a scientific point of view. And we were very clear in the beginning that wearing masks is not about protecting the wearer, but much more about protecting other people, right? Especially individuals who are belong to the vulnerable community. And our order, our formal order said, only when you're not able to keep yourself 6 feet from other folks. Because the 6 feet distancing is very important. And so you probably, for those of you who live and work in Orange County, you probably heard what has happened to our former health officer as is related to protests. People were picketing in front of her house, death threats in social media, and clearly in front of the board supervisor meetings. And then her addresses has been shared widely in the social media. That prompted her to resign or separate from the county. The day before she resigned from the county, and so on top of that, there has been inconsistency from WHO to CDC to the State Department of Public Health as is related to face covering guidance, right? So CDC and WHO only recently strongly recommend, I think CDC only recently strongly recommend face masks and doesn't say that it is a requirement. That's the difference. And WHO is wobbling back and forth about it. And WHO previously, as of 3 weeks ago, state that mask has no use. Only recently did they change that, okay? And CDPH, as we reopen the business into the community, different sector into the community, every single guidance for business to do due diligence before they reopen, the piece on face covering is not a requirement, but rather a recommendation. So the wording here is not a shall, but a should, right? So that's number one. Number two, there was no guidance on how do we, when we apply to reopen the business, there's a piece on the application we need to speak to, and that is how do you contain and what would you modify if you notice that your situation in your local county is worsening. Meaning if the number of deaths and the number of positive rate increases, and then your personal protective equipment dwindle down, then what do you do? And at that point, there was no guidance from the state on, well, what is the marker? What core measure do we follow in order for us to say, aha, we are now getting into a dangerous situation that we need to remediate, and what is the plan of remediation? So a day or two before Dr. Nicole quit, because of all of this unfortunate, unseen public outrage of a smaller group, but unfortunately they are the loudest group, right? And so, the state issued what they call a monitoring guideline. So there are several factors that the state said, we will monitor you. If you hit this mark, then you need to submit to us a plan on how you're going to remediate. And so my strategy was, if our guidelines for face covering, first of all, is not consistent with the state and the CDC, already put us there, meaning if we need to remediate, we can't say we are now going to enforce masks, because that doesn't make sense. Your order said everybody must, right? Then the next option that we need to do would be start closing back down businesses. And you and I know that would be a day in a hot seat if we start reclosing all the businesses. So my statistic epidemiologist team look at our data in Orange County. Now, I know Allison talked about the number of people who get infected increasing, but that's expected. As you reopen the business and people are back into the community, you will see more infection, right? But it means that you really have to test everybody and look at exactly the rate of how many people who are infected compared to all the people in the population. And so that is the established rate, and the state has a rate and said, if you cross that threshold, then you need to remediate. The other monitoring criteria that the state has is the percentage of ICU bed available, as well as the percentage of ventilator available. And from all of those measures, we are actually doing very well in Orange County, right? And so if you base on our statistic and you base on, should we ever get there where I need to come up with a remedial plan, I have nothing except for, I'm just going to start closing down businesses. And knowing that nobody enforcing the mask, so I scale it back from a shall to a should, because my strategy is, should we ever get to the point where I need to come up with a plan, then my plan would be, okay, now we're going to really make everybody wear a mask, okay? And with that, collectively, if the community decide that our first step of remediation plan is everybody wear a mask, then the sheriff cannot say that he won't enforce it. Does that make sense?
Yes.
So he's going to be forced to enforce it, because if he doesn't enforce it, then we're going to have to start closing down business. And he would have to respond to the business community on why he allowing us to get to the point where we are closing down businesses.
Thank you, Dr. Chow. We just have time for one more question, and this is aimed toward Dr. Park. Can you recommend strategies to have conversations with older adults around the risk of depression and suicide?
Sure. I think that that's a great question. And I think that it is, so the question is, it sort of depends. But I think there are certain principles that hold true regardless of the setting that we're talking about. I just wanted to say that in terms of having conversations with the older adults in our lives, for example, on a personal basis, I think the same principles apply whether you're working in your community or other folks within your professional capacity, or if you're doing it in your personal life. The thing to keep in mind is that having conversations about depression or their suicide risk or the risk of depression in the midst of the pandemic is aimed towards figuring out how we can best support our seniors, obviously. And the number one protective factor for seniors, for older adults, is social support. So I would just say from the get-go, by starting to have the conversation, by reaching out and indicating that you care and indicating that this is something that you're concerned about for an individual, that is a major protective factor in terms of depression for that person. Social support, we know, is the most important thing. That being said, I wanted to go over some principles as developed actually by folks at my agency, Carolina, who is our director, and Sarah Kim, who's our clinician, about talking about suicide in particular, but I think this applies to anything around mental health. So some principles I would recommend are being direct. As Dr. Chow said, there is a lot of stigma around talking about suicide in particular, or even talking about depression, and that occurs, that's internalized even for those of us who are clinicians. So it's really important to be direct and be open and to talk about what it is that you're concerned about, and to ask specifically, if you're concerned about suicide, have you been thinking about suicide? And not to fear that by somehow, as Dr. Chow mentioned, by talking about it, that somehow you're going to plant the seed in their head. If they're thinking about suicide, they're thinking about suicide. You asking about it doesn't make them more likely to think about it. Being willing to listen, being non-judgmental, and reassuring them that help is available. So obviously when we talk to older adults in our lives or in a professional capacity, it's not as if we're going to ask like, hey, are you depressed? And if they say yes, you're just going to leave it at that. Obviously you want to be able to reassure them, hey, you know, if this is an issue for you, we can get help. We can find these resources. We want to try to find intervention so that things feel better. Being honest is obviously very important about what you know and what you don't know, what you can and cannot do. And I think those are some general good principles to talk about depression and suicide risk.
Thank you very much. So for those questions we didn't have an opportunity to get to, please know that we will post the answers on our website. Now I want to thank Dr. Chow, Dr. Ramos, and Dr. Park for their time and for sharing their expertise. That was a lot of information shared today. And we appreciate the wonderful work you are all doing in Orange County to advance the mental health of our community. I'm now going to turn this back over to Allison Sonnenschein, who is going to close out our final session of the Women's Health Project 2020 Summit.